Live from the Washington, D.C. area, it's the Inside Scoop, all the news that our viewers want to know. Now, here's the host.
Good evening. Welcome to the Inside Scoop. I'm your host, Lindsay Davis Stover, and we have a great show this evening. Joining us tonight is Dr. Joseph Sakran, who is the Director of Emergency General Surgery at Johns Hopkins Hospital. Dr. Sakran, thank you so much for being with us.
Thanks so much for having me, Lindsay. It's great to be with you tonight.
Well, I have been looking forward to having you on this show because I know we're going to be discussing a topic that is so meaningful and timely right now. And I want to start out by just having you tell us a little bit about that Friday night in 1994 that really forever changed your life.
Yeah, absolutely. And I was born the son of immigrant parents that came to this country in search of those hopes and dreams that I think so many of us strive for. And born right outside our nation's capital, actually here in Fairfax, Virginia. And at the age of 17, my life really changed. I went from being a healthy high school student to collateral damage after I was nearly killed when shot in the throat with a .38 caliber bullet. And Lindsay, I don't know how you were at 17, but I think most of us at that age, we don't appreciate the fact that we're mortal. We have no idea what we want to do for the rest of our lives. And so it was a moment that really just changed the entire trajectory and path that my life took. It really kind of inspired me to go into medicine, inspired me to become a trauma surgeon. And then, most recently has me working at this intersection of medicine, public health, and public policy.
I mean, as you said, being a 17-year-old and experiencing that, I mean, it's so traumatic on so many different levels.
Yeah, I mean, that's spot on. It is, it's just hard to imagine, to be honest. I mean, here I was, this healthy kid, and all of a sudden I wake up in the hospital. I've just come out of surgery. I have a tracheostomy tube in. I'm on a ventilator. I mean, it was just absolutely devastating. And, it really, I think, just taught me a lot of things. I mean, I had to learn how to essentially walk again because I was hospitalized for so long and you lose a lot of your muscle mass. I have a paralyzed vocal cord. So, that's something that never really comes back. At the time, I had a tracheostomy tube. And so you can imagine, just being 17 and having all those things happen is just not normal, let alone the fact that this happened because someone pulled out a gun and was firing to the crowd.
I mean, it's really just even hard to put your head around, to even grasp, right? And I think that is, to me, what is so remarkable about your story, because you did experience something that no 17-year-old should ever, no person should ever have to experience, but especially at such a young age. And far too many children in our country are having to experience this. Can you talk a little bit about that moment inside of you when you realized that you were going to take this tragedy and turn it into something that really served to help others?
Yeah, well, it definitely wasn't right away. Let's just be clear about that. I think, after spending a significant amount of time in the hospital, I ended up, coming back. I was a senior in high school at the time, Lake Braddock, and I ended up coming, out after a number of weeks being hospitalized, and I had to again relearn everything, just kind of the basic things of life and daily living. But I also had to catch up with all the schooling that I'd missed and really try to catch up with the class that I was a part of. And I remember one morning actually being, pretty just kind of devastated about the whole situation. And I was standing in the bathroom and I was looking at the mirror. And what I didn't realize is that my father was standing in the corner.
Mm.
And I think when he looked in, he saw the devastation in my eyes. And he came in and he said, "Look," he said, "Joe, what happened to you was terrible, but you really have two options. The first is you can, feel sorry for yourself." And I think that was, the typical, like, tough love from a parent, right? But the second is you can take this terrible tragedy and try to use it in a positive way to impact the lives of other people. And I think that's really what kind of just changed everything. It was an aha moment where I decided that that's exactly what I was going to do. And, looking back now, Lindsay, the worst moment of my life also turned out to be the most impactful because it has been doing the things that I'm doing today. And again, trying to impact and save the lives of other individuals.
Mm. So that experience, would you say is what led you into medicine? Is that what first got you interested in going into medicine?
Yeah, definitely. It was pretty, I think, clear, shortly after being home for a few months that I wanted to take that second chance that I was given and try to give other people the same second chance. And I just thought for so many years, even before going to medical school, is how amazing would it be to have a kid with a similar injury and you're able to save their life and allow them to go on and impact other people. And I just kept thinking about, that ability to really develop the skills to do that. And that's what I decided to work towards.
That's incredible. So in your work today, I mean, you see the aftermath of gun violence on a daily, weekly basis sometimes, I'm sure. Can you talk about the impact that that has on you and other healthcare providers? Because, as we're talking about this issue, I mean, I think the second and third order effects are sometimes the ones that don't get discussed too, that are just as important. Can you talk a little bit about the impact that it has on you and the healthcare workers around you? Because you see tragedy more than most.
Yeah, we definitely do. I mean, it is part of our job, but I think you're getting to such an important point. Just because it's part of our job doesn't mean it's any less traumatic. Traumatic not just for the patient, not just for the family, but for us as clinicians on the front line. And there's an actual term for that. It's called, the second victim.
Mm.
And essentially, the point is that we as clinicians, as trauma surgeons, nurses, we're also impacted by the devastating injuries that we see day in and day out. And let's be clear about this. Gun violence is a public health crisis in America. It's uniquely American. And it's not just, the random mass shootings that you see, which get a significant amount of media attention, right? But it's also, the young Black men that are being killed on our streets in cities like Baltimore, Philadelphia, Chicago. And Lindsay, those stories often go untold.
Mm.
And so we have a responsibility to tell those stories because, brown and Black communities are disproportionately impacted. And this is a daily, occurrence.
Mm. Well, on that point of stories, because I think, as you said, telling these stories in so many ways is maybe how we break through a lot of the noise, right, of this issue, and how people can be so partisan. To me, it shouldn't be a partisan issue, but there are those that make it one. And stories have a way of cutting through so much of that. Is there a patient or a person you've met along the way in your journey that their story, along with yours, has just had a huge impact on you?
Yeah, I mean, there are, you may not be surprised, a number of stories, but one that really I think about actually quite often is something that happened not too long ago. It was a 17-year-old kid actually who was shot in the head, and he was brought to our trauma center. And despite, you know, how advanced, our medical healthcare system is at Johns Hopkins, despite how excellent, the training is that so many of us had, he had a devastating traumatic brain injury.
Mm.
And I remember, we had to take him to the surgical ICU, where essentially, we knew that we would never be able to bring him back and have this kid, regain the quality of life that he had before this injury. And as he was up in the surgical ICU, I had to go up and talk to his mother and to explain to her, the scenario of what was going on. And as I walked into the room, um, you could see her there at the bedside, holding his hand, and really kind of holding on to, any, glimmer of hope. And as I began to explain to her that her son was uh, having such a devastating brain injury, and that really there was nothing medically that we could do that was going to bring her son back, she did something that was very interesting. She began telling me about her son, and she began telling me about how he was the first in their family to graduate from high school, which, in Baltimore, especially in the African American community, that is a big deal, right? He had hopes and dreams of going to college, just like, so many of us, all of which, will never come true. And as she was telling us about her son, I was standing there with the rest of my team and other healthcare workers. And she looked up and she saw, I think, how distraught we were as individuals that were trying to do everything possible to save his life and bring her back to him. And she walked over and she did something that I'll never forget. She put her hand on my shoulder and she said, "Are you okay?" Now, just think about that, Lindsay, for a second. Here's a mother that just lost her son, and she's asking us if we're okay. It's moments like that which really restore my faith in humanity. And it's moments like that which get me to wake up every day and to do everything possible to prevent gun violence in America.
Mm.
And it's just one of those stories that you can never forget.
No, that is such a powerful story. And unfortunately, there's so many stories like that, we have to continue telling, because we have to be able to break through on this important issue.
Yeah.
And that brings me to the next question about your intersection between medicine and policy. I know we have a shared connection from the Kennedy School, and I know you have worked so hard taking your expertise in medicine and also your experience being a victim of gun violence, and brought those two together to really work hard to create policy changes. Can you talk a little bit about your decision to work in the policy area as well as you move through this?
Yeah, sure. I mean, let me just say that I never had the intention of working in the policy arena. My entire kind of, premise and like really just thought process was if I could give other people the same second chance I was given, that's it. I would have like, that's success right there. And then what started to happen was I began to realize a couple things. Number one, in the case of this young man that we just talked about that had that devastating traumatic brain injury, the best medical treatment for that kid is prevention.
Mm.
And so that prevention has to happen beyond the operating room. It has to happen beyond the trauma center. The second piece that I realized, and this wasn't until I was in fellowship at the University of Pennsylvania, where we would bring in young teenagers, 14 to 15-year-olds, from communities all across the city, and we would give them a tour of the trauma center, and then I would talk to them about gun violence. And the first time I did this, when I began talking to them about gun violence, they're kind of paying attention, but not really, which,
Mm.
may not be a surprise to those of us that have, teenagers that are 14 to 15-year-olds, right? But then I told them my own personal story.
Mm.
And all of a sudden, just like that, all of their eyeballs focused on me. It was, Lindsay, a reaction that I had never seen before, and one that frankly I wasn't expecting. And what it taught me in that moment is I went from being, this person wearing a white coat to someone that could relate to what each of these kids have faced in their own lives and in their own community. And so that ability of really turning that public narrative into action and using my story to impact others really kind of came to light.
Mm.
Of course, that got me thinking, okay, well, how do you become effective in this area? And so, as a clinician and a surgeon and someone with no public policy background, I said, okay, let me go and spend a year really building that skill set. So I went to the Harvard Kennedy School where I spent a year working on public policy and different strategies for communication. And that was an incredible theoretical kind of underpinning. And then, as you know, I spent this past year in the United States Senate working for Senator Maggie Hassan and really kind of working on our health policy team and understanding the practical aspects of the federal legislative process. And that's been invaluable.
Mm. Well, I mean, you bring such a unique perspective to policy. I mean, as someone who has experienced it themselves, but has the expertise in medicine and policy, I mean, that is, in my mind, the perfect combination to work on the much needed changes that our country needs to make. And, we continue to have this discussion, and oftentimes, unfortunately, the discussion heats up after a tragedy, right? Whether it is Santa Fe High School, in which I had a cousin who attended Santa Fe High School and experienced that horrific tragedy, or, taking us back to Sandy Hook, when we literally saw babies, 6-year-olds, right, have to experience something that no human being should ever have to experience. And it feels a little bit different right now, especially after Parkland. Maybe when legislators didn't have the courage that we needed them to have after Sandy Hook, we do find some courage after Parkland. While I would argue it's not enough, we have seen some changes because these young activists, my cousin included, are just remarkable and they haven't stopped. Can you talk a little bit about the activism, especially among the younger generations, on this particular issue?
Yeah, I think you're spot on. I mean, the young people in this country have re energized America around this issue. I definitely think, this has been one of the critical moments in the gun violence prevention movement that we have seen, as you alluded to, really after Parkland. I would also say that it's important to remember while we've been like super frustrated, those of us that care about this issue, to not see significant action at the federal level, or at least to the extent that we need to see it. It's important to note that in America, most governing happens at the local and state level, and we saw that here in Virginia,
Mhm.
right, this past year. And I would just say that, when you look at, I think in 2018, there was like over 67 pieces of gun reform legislation that were passed in states all across this country. And that's because, folks like decided to be involved in their communities, to speak up, whether it was the Moms Demand or the Brady folks or the Giffords, right? Or just regular people that said, no, I'm not going to stand on, the sidelines of history as people continue to be injured and killed every day in our community. I think the other thing that has happened is this has gone from an issue that is like, everyone was afraid to talk about, to something that we're seeing right now in the presidential race as a central piece of the platform that folks are running on. We saw that also in 2018. And when you look at, just as an example as to how much change we've actually seen, when you look at Democratic House members, right? In around 2008, there were about 63 that were A rated by the NRA. You look at 2018, so 10 years later, that number I think was around 3 individuals. So you can see that there's a paradigm shift that is happening in our country. And the last thing I would just kind of say about this, and you kind of alluded to it earlier on, and that's that, this is not a fight against responsible gun owners. And I think when we look at, the gun lobby, and you look at like the leadership of the NRA, the leadership does not represent the membership. And that's an important point. The majority of Americans, including the majority of responsible gun owners, are actually in favor of some of these basic, common sense measures we talk about, like, expanding background checks. So I think that as Americans, we have to recognize there is a lot more that unites us than divides us. And we don't always see that false narrative. Or sorry, we don't always see not the false narrative. We don't always see, that perspective because people are pushing a false narrative.
Right, right. The political agendas of groups like the NRA, right, seem to take front and center.
Yeah. And it's
And
not just groups, it's the leadership. Like, I think that's so important because even when they poll NRA members, the majority of NRA members want background checks. They want you to expand it. So, but the leadership refuses to actually follow what the majority of members even want.
mm,
I think is a critical point.
well, and the New York Times just about a year ago came out with a poll that said 98% of Americans are in favor of universal background checks. I mean,
I,
that is, I don't know how you get more of a majority than 98%, right?
well, I was just going to ask. I can't think of anything that 98% of Americans agree upon. So
Sure.
it's such a great point, and it's important to think about for sure.
Absolutely. Well, I know, and I know we'll spend some time on this in the next segment as well, but you have started some organizations that have made a huge impact, whether it's Docs Demand or others. Can you talk a little bit about some of those organizations where you've really worked to organize, doctors and healthcare professionals and your community around this important issue?
Yeah, so I think one of the things that folks are realizing within the healthcare community is that our voice is so important. Whether you're talking about, gun violence in America, or you're talking about our other public health problems like the coronavirus. We are, I think, so critical to these social movements, to being part of the solution. And I think, Americans and communities, they trust us as their clinicians and as their providers. And one of the things that I realized early on is, we had a responsibility to the community to really speak up and to speak on behalf of, not just the community, but our patients. We are front and center of taking care of these individuals, day in and day out. And so you can imagine when, situations and organizations suggest that doctors or other healthcare professionals should not be involved in these type of solutions, or should, stay in their lane. A lot of us within healthcare actually rose up and said, no, that's actually wrong. And in fact, we were incensed, because if anyone thinks that they can solve these complex health problems on their own, they either don't really understand the problem, or they don't really have the intention of trying to move the needle forward. And so, we stood up, and what we began doing is we began sharing our stories. We began telling the stories that so many people across the US and even abroad were not really familiar with or had never heard. The stories of our patients and what we were facing, and allowing the public to understand the tragedies that were happening on a daily basis. And it really, I think, taught a lot of us a number of lessons. But I think perhaps one of the most important, and we've been talking a little bit about this and about the importance of stories, is that, like, the data is important for sure. And the data helps us drive, appropriate policies. But the data doesn't change the hearts and minds of people.
That's right.
It's making them understand, why this is so personal to us, to families, to communities, and to this country.
That's incredible. Well, I know we're going to talk more about the data, more about the impact of stories, and what we can see coming up in this next election to ensure that voters get to the polls. So please stay with us. More to come with Dr. Joseph Sakran. We'll be right back.
2 units of blood. Let's go. We're losing her.
Come on. Stay with me. You can make it. This could have been prevented.
Come on, sister. Let's play. We'll be back. Do you want to play dress up? Here, put this on. How do I look? Super cute. Look at me.
Girls, what's going on up there?
Nothing.
Here I go. Me and my wife were out to dinner when we got the call from the babysitter saying that our oldest daughter was hurt. We rushed here as quick as we could.
What are you doing? Is that Mom's jewelry box? Whoa! Don't fall, she'll hear us. Help me. Got it.
There was severe damage to her organs. She lost a massive amount of blood. The damage was just too severe. There was nothing anyone could do. I'm so sorry.
Oh no. Oh no. Please tell me that's not true. No. How could she die? I demand to know what happened.
Wow, it's heavy. Let me hold it. Wait your turn.
Everything looks great for your checkup. If you have a gun in your home, is it locked?
No, but it's hidden.
The best way to safely store a firearm is locked and unloaded in a safe with the ammunition stored separately for everyone's safety. Girls, what's going on up there?
Nothing. Help me. Got it. Oh, it's not opening. Then let's find Mom's jewelry box.
The best treatment is prevention.
Our fight against coronavirus isn't over. Let's wear face masks in public, stay 6 feet or more from others, follow state and local guidelines, and wash our hands frequently. Let's move forward together. Learn more at coronavirus.gov.
Before we celebrate the freedom most Americans have, we must fight for the freedom all Americans deserve. Because all lives can't matter until Black lives matter.
This is where you rise, this is where you shine, this is where you become the greatest of all time. History in the making. This is history in the making. History in the making.
Vote for your life.
We're back to the Inside Scoop. Here again, your host.
Welcome back to the Inside Scoop. I'm your host, Lindsay Davis Stover, and we're continuing our conversation this evening with Dr. Joseph Sakran, who's the Director of Emergency General Surgery at Johns Hopkins Hospital. Thank you so much again, Dr. Sakran, for joining us this evening.
Thanks so much, Lindsay. It's so great to be with you.
Well, we spent a good part of the first segment really talking about the impact of stories and how important they are. And stories coupled with data in many ways is how we create good policy. Can we talk a little bit about some of the statistics that our country is facing right now in terms of gun violence?
Yeah, I think this is so important. And look, when you look at this, what I call a uniquely American problem, every day we have 100 individuals that are killed secondary to a firearm related injury. And this does not even begin to include the number of non-fatal injuries, which conservatively is estimated at 2 to 3 individuals per death. And it honestly depends upon, the state that you live in, the center that you're a part of, as to whether or not some of those are captured. And that's important because we know that those non-fatal injuries, that's a really important population, because in some communities, the recidivism rate, meaning the rate of coming back and being injured again, can be, upwards of 50%. So this is something, again, that's affecting communities all across America. We also have to mention the fact that 2/3 of gun violence deaths come from suicide. And people often forget that piece or neglect to mention it. Some people will even say, oh, well, suicide, that's not really, gun violence. Well, in fact, it is. Suicide is a violent act against oneself. And so that is a really, critical piece that we can talk about more if time permits. And then we have 1/3, so the other big portion being homicides. And, we've talked about how brown and black communities are disproportionately affected. And then, of course, we have another portion being unintentional injury and a variety of other pieces. And that's so critical, especially as we think about, kids across the US. We know that every day 21 children and teens are shot in the United States. And we also know that in this country, there are 4.6 million children that live in homes with unlocked and loaded weapons. And when you talk to any responsible gun owner, they'll tell you that's unacceptable. And that really kind of gets us into, different ideas as we focus on safe storage and so forth.
I mean, that is so critical. And you've really laid out all of the different ways that gun violence affects families here in the US. And one way that you brought up that you're right, people don't talk about enough is suicide. In my past policy experience, I've worked on veterans policy, and we are losing close to 22 veterans a day in many cases to suicide. And right now we're in the midst of a global pandemic. And I know you and I've talked about some of the second and third order effects of this is going to be on people's mental health. Can you just expand a little bit more on that suicide statistic? Because you're so right. People don't talk about it enough. And it is something, while we're having this broader discussion on working to end gun violence, it is definitely a piece that needs to be addressed.
Well, the example that you mentioned with our veterans is such a timely example, because you're right, it is impacting our veterans significantly. Individuals that have served this country in so many different ways, yet often because of the service and other circumstances, are really facing post-traumatic stress and other different manifestations that put them at risk. And when we talk about firearms, and we talk about that in the relationship with suicide, what's so critical to understand is that if a suicide attempt is performed with a firearm, the fatality rate is so high, above 90%. And why is that important? It's important because we know that most people that survive a suicide attempt, they go on to live relatively normal lives. They don't go on to die from a second suicide attempt. But if they're using a firearm and the fatality rate is so high, they're never going to have that chance in the first place. And, the other piece of this, as we think about, so many of our family members and our loved ones, right? From the point when someone makes a decision to attempt suicide till the actual first attempt, 70% happen within the first hour. So intervening after they've already made the decision is probably not the most effective way. And so that's why, as a community, we have to really come up with different ways, whether it's extreme risk protection orders or other methods, to recognize these individuals and provide them the mental health and well-being that is so critical to prevent these injuries from happening.
Absolutely. I mean, it is such a critical issue and such an important piece to this discussion. And two, we've got to continue talking about every aspect of this issue if we are really going to make the meaningful policy changes that we need to make here in this country.
Exactly.
And I want to talk about those because we talked a little bit in the first segment, right? And joked about the 98% and what other issue is out there, right? That 98% of Americans agree on. But can you talk a little bit about the policy changes that need to be made in this country to really, really have meaningful impact on this entire issue?
Yeah. Well, look, like any complex health problem, like any public health issue, there's a couple things that need to happen. The first is we have to really approach this from a public health perspective. And here's kind of what I mean. In our country, we have had numerous experiences with other public health problems. The example I often give is motor vehicle fatalities. And when you look at what happened in the 60s and 70s, right, when the fatality rate was so high, we didn't get rid of cars, right? We came up with ways to make it safer, whether it was airbags or seatbelts or making the road safer. It's changing our really kind of approach from focusing specifically on trying to change human behavior, which we know is not necessarily cost effective, to actually changing a system that makes it less likely you're injured. And so as we look at this from that perspective around gun violence in America, really it's doing things, like expanding, the background checks and making sure that we close those loopholes and that, people are not able to buy them, whether it's on the internet or, at the gun shows. It's, addressing, the lack of funding when it comes to research of firearm injury, right? Up until recently, the federal government hadn't appropriated dollars towards researching the etiology of gun violence prevention for over 20 years. And that's absolutely unacceptable, because anyone can tell you that you need to have the right evidence and the right data to help drive those policies. There's also aspects of focusing on things like safe storage, right? We have talked a little bit about, the unlocked and loaded weapons in homes all across America. 8 children and teens are shot in instances of family fire. And this might be a good time, Lindsay, for those that don't know that specific term. Family fire is a shooting that involves an improperly stored or misused gun in the home, resulting in an injury or death. So, these are just a few small examples, but really you have to tailor, right, the interventions and the solutions based on the specific aspect that you're trying to change. And so it's going to be different for, suicides versus homicides and so forth. The last thing that maybe I'll mention that I think often doesn't get enough attention is really, as we look at a lot of our cities and urban communities, we have to focus on changing the structural violence that exists and really focusing on the social determinants of health and breaking down the barriers where we have right now healthcare systems and the public health department and law enforcement functioning in silos, breaking those barriers down so we can really work in an integrated fashion that allows us to address some of those structural and social issues that the end result can often be gun violence. And so those are just a few examples.
What do you think? Those examples, right? And the policy and logic behind them, right, is there. And we have seen a majority of Americans really share some of those, views and need for policy change. What do you think has been the main obstacle in getting some of these common sense policy changes passed, whether it's at the federal level or even at the state and local levels?
Yeah, it's a really good question. I think, look, to answer your question most directly, I would say there's 2 main things. Number one, the structure of our government. We know that, you need essentially 60 senators, right, to pass legislation. We've had essentially, bills like HR 8, the universal background check bill that has, passed the House, a long time ago last year, right, and still has not been brought up for a vote. But the other piece outside of those basic, number of individuals you need to be on board is the impact that money has in this conversation. And we have seen essentially the millions of dollars that the gun lobby has thrown to try to influence elected officials. And so we're starting to see, really, though, our elected officials start to speak up and to have the moral courage to actually do the right thing and not to be afraid of the gun lobby. When you look at what happened in 2018, we had so many candidates that were running on a common sense gun reform platform. So just to think about the fact that they are doing that is just a small illustration of how things are actually changing. The last thing I just want to make sure we, again, just underscore is that this is not a Democratic issue. It's not a Republican issue. This is a uniquely American issue. And like we've talked about earlier in your segment, the majority of Americans are not in disagreement as to some of the things that we should do. And I think, frankly, what is starting to happen is elected officials that are not willing to represent their constituents, they're being voted out. Constituents are voting on this issue. And I think Virginia is such a great example of that.
Absolutely. It's a fantastic example. And I feel like Virginia has led the way in so many things, right? And this is an issue that I hope we continue to lead the way on, because there's still more work to be done. You brought up the amount of money, right, that is put into the gun lobby. And I think that's a really important point. And recently we've seen the NRA, marred with many scandals, especially at the top of their leadership. While there's still a lot of money in the gun lobby, how powerful and effective do you think the NRA is right now? Because we do see this interesting kind of intersection of people rising up and voting on this issue, and also, the lack of trust in many ways that people are having with the NRA because of all of the scandal. Can you talk a little bit about how you think that has really affected their power and ability to affect change on this issue?
Yeah, I think as you're, referring, we have started to see, again, a lot of the corruption that is being brought out to light with some of these lawsuits that have been brought forward. I think that the power of the NRA is actually diminishing. And we have seen that, I think, in a variety of different ways. And I think one of the reasons it's diminishing is because we have so many individuals in this country that are not willing to stand by anymore and just let them essentially bulldozer over the American people. And that's what I think is so special about places like Virginia and so many other communities. It's everyday people that are coming out, again, whether it's the Moms Demand or the Brady or the Giffords, they're coming out in their own backyard and they're saying enough is enough. So, are they powerful? Sure, they're powerful, but I think that power is diminishing. And frankly, I think there's an even significant amount of frustration that responsible gun owners have with the organization and their essentially inability to represent their views on this issue. So we are definitely making headway. And I think, again, while we all want to see, change at the federal level, I am optimistic and I have hope with all the change that I'm seeing in communities and in state houses across America, that we are moving the needle forward. And we just have to persevere and just continue that process.
That's such a good point. I mean, you made a great point too earlier about the importance essentially of elections, right? In the example that the House passed the universal background check well over a year ago, and the Senate has yet, under the leadership of Mitch McConnell, to bring it to a vote on the Senate side. Can you talk a little bit about elections and the importance of them, and how you think this particular issue will be on the hearts and minds of people going to the polls in, less than 20 days?
Yeah, I mean, look, this is the most important election in modern history, in my opinion. And I think gun violence prevention is one of the top issues that Americans are voting on. It's been central to Joe Biden's platform, and I think a Biden-Harris administration would result and an opportunity to implement real change as it relates to some of these common sense measures we're talking about. I really, envision, frankly, something like an interagency White House Council on Gun Violence Prevention. I think it's going to be so critical that a Biden-Harris administration really bring in key leaders across the administration in a coordinated fashion. I think we'll see it. They've been so committed to making sure that happens and making sure they address all of the different facets of gun violence in America, including the disproportionate impact on brown and black communities. I cannot, underscore how important it is that each and every one of us vote. It is so critical. Our voter turnout rate tradition has been so low because most people don't believe that they can make a difference. But our vote is our power, and each and every one of us can make a difference. So if there's nothing else that you do this year, just please vote. It is so important. Gun violence is on the ballot. Healthcare is on the ballot. There are so many issues that we care about that is on the ballot. And that's how you make your voice heard.
That is so true. I mean, the power of our vote, especially at a time when so much is at stake. And I know here in Virginia, we have elections every single year. And there are many that say, oh, this is the most important election of our lifetime every single year. But you're right, this one just feels different. The gravity of it feels just so different. And, I think, as many have said, the democracy is at stake, and it definitely feels that way. And two, I think we have an opportunity to make some real changes in the Senate. Do you think if the Democrats were to take the Senate, that something like universal background checks would finally be up for a vote?
Yeah, I think if we were able to take the Senate and take the White House, I think that it's definitely going to be up for a vote. And I'm hopeful. I mean, we look at, Senate races in South Carolina, where we have Jamie Harrison, who is just incredible and doing such a terrific job. And it is possible that we take the Senate. And I think that it will definitely make an impact on gun violence reform and some of the changes that are coming down the line. So I completely agree. So we can't forget about those kind of downstream ballot tickets.
That's right. And you've made the important point several times this evening about, so much of our policy is made at the state and local levels. And I think we can't encourage people enough that, yes, the presidential is critically important right now, but so are the elections at the state and local level, because real policy changes have to be made at all levels of government. And so, as you've made so eloquently, we can't ignore the state and local races this year as well.
Yeah, and in Virginia, we have, I think, a number of critical ones. We have, Congresswoman Jennifer Wexton, who is obviously up this year and on the ballot. We have Dr. Cameron Webb, who is running the 5th District, fellow colleague. So we have a number of terrific candidates. And, it's our responsibility to get the type of people in office that we want representing our views on so many issues, gun violence being one of them.
Absolutely. Absolutely. Well, I'd love to hear from you what it means to you and your family to have the right to vote.
I mean, Lindsay, it's everything. As I think I mentioned, I'm the son of, immigrant parents who essentially came to this country with nothing. And, both my father and mother worked tirelessly to try to do everything in their power to give us, the opportunities that they never had and to give us a better life. And being able to vote, I mean, is, I think, the most fundamental, part of our democracy. And it's something that we control and no one else, you know, controls, at least not in the US. So it is so critical that each and every one of us exercise, you know, that civic duty that we have, to try to make this world a better place. And I can tell you that, my parents and I, we just finished voting. Actually, we sent in our mail in ballots the other day, and it's always such a proud moment. Because of COVID, we decided not to vote in person this year. But it's still just as profound. And so I just can't underscore anymore how important it is for each of us to get out there and to exercise that duty.
Well, I love hearing people's perception and what it means to them personally to vote. As we've talked about so much this evening, the power of stories, right? And I think that is so profound because to each and every one of us, there is something special that is meaningful to us as we exercise our right to vote. And I love that you make it a family affair. I too make sure and take my daughters to vote with me every single time I go to the polls because it is critically important. And as Dr. Sakran said, you can vote by mail, you can vote early, but whatever you do, have a plan to vote because gun violence prevention is on the ballot. Healthcare is on the ballot. The future of our democracy is on the ballot. So please exercise your right to vote. Reach out to your neighbors, your family members, people you may have never met before, but call them on the phone, send postcards, do whatever you can to get people out to vote this year because it is critically, critically important that we do that. Dr. Sakran, thank you so much for being with us and for sharing your personal stories and your experience with us, because having people like you in positions to help create important policy is how we're going to make the needed changes that our country needs to make on this issue.
Well, look, Lindsay, thank you so much. It's been such an honor as someone that was born and raised in Fairfax, Virginia, and someone that has always considered himself a Virginia boy. It is just a true pleasure to be on with you and to have a chance just to speak to fellow Virginians about what we have to look forward to in the future. So thank you very much.
Absolutely. And again, please make a plan to vote. Thank you for joining us this evening, and we hope you will join us again next week right here on Inside Scoop. Good night.